Cast is now starting. All attendees are in listen-only mode.
Hi everyone, I'm Nikita Doshi and welcome you all to the closure ceremony of the Mind Matters Week. While we are waiting for more people to join in, I would request all of you to just go on menti.com and type this code 6378958. Just share your experience of NHRDN and Mind Matters. So while we're waiting for others to join in, if you can just go to menti.com and use the code 6378958 and describe your experience of this entire NHRD and Mind Matters week. You can type multiple responses too, and your responses would appear here. One word responses. So I'll request all of you, I can probably also paste the link. Okay, so we have a first response. Would request others also to type in what has been your experience of NHRD and Mind Matters. You can type in multiple responses too. I'll give it 2 more minutes before we start, and we also wait for other people to join in. Okay, I see. Enriching, enlightening, amazing. Last 1 minute for you to enter your responses. I'll just request other panelists to go on mute. Okay, thank you for sharing your responses. Last 15 seconds. Okay, thanks everyone. In case you want to type in, it is open. You can, type in more responses later as well. So welcome everyone. I'm Nikita Doshi. I'm part of the NHRD Bangalore chapter executive committee and also work in the learning team at Publicis Sapient. Invite all of you for the closure ceremony and an interesting panel conversation today for the Mind Matters Week. It's a movement to promote mental health awareness, which is the need of the hour in today's times. To talk little about NHRD is of HR professionals. We have 30 chapters, about 13,000 members, and been there for over 3 decades. You can visit our website if you want to know more details and also to become a member. For the closure ceremony today, and before we get started, with the panel conversation, we have with us Krish Shankar, who is the National HRD Network President and also the Group Head HR of Infosys, and he's been the lead for this entire Mind Matters movement. So I'll hand it over now to Krish to just take you through a little bit about Mind Matters and how did the entire week go. Over to you, Krish.
Okay, good morning, everybody. And thank you all for joining in this morning on a Saturday morning, finding your time for this. So really grateful for that. I think one key thing I wanted to thank you is I think many of you have done a phenomenal job over the last few days, kind of championing Mind Matters and mental health. So again, thank you for all of that. Basically, I think it is what I want to say is mental health in India has not really been talked about very much, right? In corporates, maybe the corporates with large numbers used to have something on mental health, but otherwise we never really spoke too much about mental health within in the Indian corporate world. But I think things are changing. We've got the whole society is changing in a way, and that is leading to certain kind of what you call pressures. And on top of that, now we have this pandemic, which is also removed this all the social interaction as well as isolation, and that has caused more issues. So it's important that as organizations we talk about mental health, and spread more awareness. And I think if you would have seen a survey, I think one of the reasons is that while 60% of the companies have something about mental health, one of the biggest barriers is the stigma related to mental health. Yeah, and I think if you ask people why are they not approaching anybody, I think it's all about stigma. It's all about what will they think of me. It's so much of concern about that, and that I think is really holding people from talking. I think that's where awareness really comes in. And I think if we all work together to create more awareness, so that people can talk about mental health, people can support others about mental health. And people who have mental health issues can also reach out much more openly and feel that they are not kind of under a kind of a lens or a judgment. So I think that's the kind of change we need to bring. And I think this is a beginning in a large way, a movement that we wanted to create. We're thankful that many of the companies have taken up, more than 120 companies have kind of volunteered to do it. Many of you have led this, so thank you all. So if you just look at some stats here, I think over the last 1 week, 110 companies signed up to really drive this in their organizations. And we had various sessions. I think some sessions were just awareness sessions, but there were some deep dive sessions. And I think we are thankful to some of our partners like White Swan and TISS who helped us really understand and get into deep dive. And deep dives may not be for everybody, but for people who want to understand a little more. So we had all those deep dive sessions. So over the last, 5 days, about 3,300 people came, eyeballs or footballs or whatever, they heard us in these sessions with a good feedback score with 4.5 out of 5. And more importantly, I think our social media impressions, almost 4 million impressions on Twitter. I hope many of them have actually kind of made a note of it. I think what you see is basically based on all the support we've had from everybody, including our partners, we've got a comprehensive toolkit, and this toolkit is really for everybody to use, and we're going to, it's free to anybody to use and see what they can do. We've had lots of these deep dive sessions that you did. We also certified some ambassadors, and if there is more need, we're happy to do more because it's important for us to help in whatever way it is. And we also wanted to get some leaders involved, CXOs, some stories of people with resilience, just to ensure that there are stories that people can talk about, share, etc., etc. On top of that, we've got other partners like Heartfulness, which did sessions on mindfulness, LinkedIn Learning, which helped us with some learning programs. So we had some podcast also. So therefore, the lots. I think so. This week has got a lot of content. Maybe some of it is still available. Some of it we can put together even more. Those videos will be available, so we'll put them together and be used by anybody in the future. Yeah. So I think thank you all for really helping us put this together. As we go forward, I think it's a glimpse. I think we've got lots of great speakers, great experts, as well as CXOs who come and shared experiences. We've also had a lot of impressions on Twitter, the CXOs, people who participated, speakers, people who listened. So all of them have gone and spoken about it. So here is the list of some of the amazing speakers we've had. Includes experts who've really been at the kind of heart of doing many of these things. We've also had people who have been through this thing and stories about their own resilience. They spoke about CXOs, experts. So I think it's a mix of many people. So thank you to all the speakers who've come forward. I really appreciate your time, and we are happy to really take all of this and see how we can take it forward for for others to take it in the future. So again, I think great set of speakers, lots of things, a lot of content, but all this would not have been possible without volunteers. As you know, NHRD is volunteers. We are all kind of do our main job, but try and spend some time helping it out, maybe in the evening or on the weekends. But we got an amazing set of people who helped us. Firstly, I think to Sujata Sriram from TISS and to Devika, who is from NHRD Chennai, but also, the passionate mental health kind of consultant from Chennai. I think both of them really helped us think about many of these things and leads to experts. Then we had the whole of the White Swan team, which really, provided the content. But here is the team, the NHRD team that really helped, I think led by Srini. Srini is the president of the Hyderabad chapter. He's also the CHRO of Bharat Financials. And he's been very passionate, I think, and they've done something. So I think it was his passion along with the team which really made it happen. I think I want to just say thank you to all of them, because many of them have really worked late nights continuously, putting things together in addition to doing their office work. So I think it's not easy. So thank you all to everybody, Dhananjay, Nisha, Avinash, and Darpan from the NHRD office. But our volunteers who are basically, Nikita, Guru, Agni, Runa, Dr. Shekhar, all of them. So thank you very much. I think, again, I want to just end by talking about our key partners. As I said, White Swan and Fulki have been the two partners who've really helped us. Fulki is, you can see a lot of work has been done on communications, all the design. So thank you, Anuradha Sharma and her team. Anu has been phenomenal. I think they've been doing this completely free, and the amount of time their team has spent on this is unimaginable. So again, thank you to them, because to do all this completely gratis is not easy. So great thanks to all of them for the time that they have spent, and to the White Swan team who are also passionate champions of mental health. So Manoj, Ranjita, and Pavitra, thank you all very much. So I think I would say that I think we've made a beginning. This is something that we've all put together. Some of it is still available. Some of the LinkedIn courses are available. All the material we have will be available, will be free. You can share it with others. You can take it to your friends, other companies you need. Because we're not going to end with this. I think this is just the beginning. We've got to keep on doing it. I think we need to create a community of people like you who are champions of mental health to help come together, help, and maybe, maybe in a couple of months we can get back and see what are the learnings and how we can take it forward and truly make a difference to the corporate world and to corporate India. So with that, thank you. And I don't want to hold you from a very interesting panel session discussion now. So once again, a great, a heartfelt thanks from us to all of you, to every company that participated, every of the spokes or ambassadors who helped us, as all the speakers and our partners. And thank you very much.
Thank you so much, Krish. I'll request you to stay on for a minute, and we'll request the entire core team, if you can just switch on your videos. We would want to see the entire core team. If all of you can just switch on the videos, and I'll request Nisha if you can just take a photograph. Would request Manoj, Anuradha, Srini as well, if they are there. I'm not sure. Okay. Do we have anyone else?
Yeah. Hi, Nikita. I'm unable to get onto the video, but please go ahead.
Oh,
changes to the
fine.
team. Yeah.
We will Photoshop you then later. Great. Nisha, if you can just take a photograph, and this is the entire, this is most of the team rather that has put this together. So thank you so much, everyone. And we'll just take 10 seconds for Nisha to take a photo. Nisha, let us know once you're done. Thank you, Nisha, and thanks Guru, Sujata, Devika, Avinash, Manoj, Krish, all of you, and Srini. Thanks a lot.
Thank you.
Thanks
All the best.
for the opportunity. Thanks.
Thank you.
I hope you all can see my screen.
Yes, Nisha, we can see your screen. Nikita.
Yeah, Nikita.
Sure. So with this, we would now like to proceed with the panel conversation, which we're very excited about. It's a topic which is very, very relevant in today's time. But before I talk about the session, I introduce the moderator. Just few ground rules. I'm sure you've seen that multiple times. We want this to be interactive, so please post your questions in the questions window, and we will pick it up towards the end of the session. We would also want to hear from you, so there will be a feedback link which Nisha would be sharing on the chat window. So do share your feedback, and like we said, and like Krish said, we are on social. So do share your experience on social media, tagging us and hashtag NHRDN Mind Matters. And this is a movement that doesn't end here. And there's a lot more work to be done in this space, so would request all of you to become mental health allies. With that, we will now move to the last panel of this Mind Matters week, and something we're very, very excited about. This is a panel on building resilience in the workplace, and resilience is a skill which is very much needed in today's times. This session would be moderated by Dr. Sujata Sriram. She's an integral part of our Mind Matters core team, has really led the way, in putting together a lot of this content and a lot of these sessions together. A professor at Tata Institute of Social Sciences. She teaches courses on psychology, research methods, human development for the students. She's also on the National Executive of Association for Early Childhood Education and Development, which is an advocacy network for children below 8 years. She's a member of International Stress Management Association. Her areas of research interest include families, childcare, parenting, marriage, divorce, mental health and well-being, making of identity, religion, and spirituality. We're really grateful, for her to bring in her expertise in this entire Mind Matters movement. With that, I would now like to hand it over to Dr. Sujata to take it forward from here.
Thank you, Nikita. I think, as I said yesterday, this has been an experience for me. It's been quite a journey. I think till last week, I didn't know whether we were going to actually have this event. And we've had the event, now we've come to the end, and we now need to think in terms of what are we going to do in order to keep the movement going. May I request Habobi, Chetna, and Soumya to please share your webcam. Chetna, we're waiting for you. Yeah. So thank you so much for making the time to be here today. I think this is part of a discussion which is long awaited. It's been something that we really need to have. I think over the week we've talked about resilience, but in terms of really understanding what resilience is, that's what we are here for, to understand from mental health practitioners in terms of how do you see resilience coming out, and what do you see and how do you understand resilience. While on the one hand, we do know that resilience is an essential part of well-being, and it comes to the forefront when people are stressed. But again, I think we need to look at it and and also try and understand what is it that organizations, families, communities can do in order to foster resilience. Because I think at the one hand, we tend to see resilience as a purely individual kind of a thing. And I feel that's problematic. And I think that's where a lot of our self-help books take us, because they tend to make them seem, all the, the tips in terms of how to do well, how to do better. All of those make it seem as if, it's an individual responsibility. And at the end of the day, what happens to the other structures in which we are all part of and enmeshed in? I hope this conversation today will actually help us look further from just the individual and look at, what is it that is there as support systems? What are structures that are in place? What are structures that can be developed? Whether it's an organizational level, as I mentioned, or even at the family and community levels. I think we need to look at all of that. So that said, I'd like to introduce the speakers for today. So first off, we have Dr. Soumya Krishna, who's a consultant psychiatrist with more than 15 years of clinical experience. She has worked on adolescent mental health. She has trained in Bangalore, and then she went to the UK for specialization in adult psychiatry work. Then she's been back in India from 2017, and she's been she's the co-founder and head of general psychiatric services at the Green Oak Initiative, which is a community mental health service. She's also the lead psychiatrist at the Hank Nan Institute, which provides services for clients with personality disorders. She's been working actively in improving the access to mental health services. Along with her, we have Dr. Chetna Duggan, who is Associate Professor at the School of Human Ecology, Tata Institute of Social Sciences, Mumbai. Chetna is MPhil in Clinical Psychology from NIMHANS, and she also has a PhD from TISS. Along with her teaching, she's also been a practicing therapist with almost a decade and a half of experience. She's been working with children, adolescents, couples, families. She's been working with a few very big research projects which look at developing resilience from the viewpoint of the community in terms of looking at school mental health initiatives, and also in terms of training of clinicians, especially therapists, and in terms of developing supervision competence. The third member of the team is somebody some of us may have already been introduced to earlier. She was there on the panel on suicide and self-harm, especially looking at issues of prevention. That is Abovi Bhagwagwar. She is a therapist with more than 20 years of clinical experience. She runs an independent venture called Manashni. Very interestingly, she runs a mental health program on radio, on a show called Conversations on Mental Health. And her private practice includes providing treatment to clients with mood disorders, anxiety disorders. She works on psychological trauma and also does training and supervision for working with complex trauma. That said, I think let's get started with the topic of discussion today. And this is a question I'm going to throw open to all three. I think on the one hand, we have, am I audible?
Yeah, now you are. Yes,
okay.
Now you are. A little bit. Yeah.
Should I speak louder?
No, I think it was the connection, so that's fine. Sorry. The connection just went.
No, I think it's important. You need to tell me when I'm not audible. So I think let's start off by looking at what constitutes resilience. Because as I said, we have this lay understanding of resilience, but as mental health practitioners, how would you define resilience? What are the characteristics of resilient people? Is it something that we learn, or is it something that we are born with? I know I've given you a bundle of questions, but let's try and unbundle this whole issue of resilience. Soumya, maybe we could start with you.
I think thank you for the introduction, Sujata, and great initiative to start with. Yes, resilience is something that I've heard a lot in the last 6 months, and somehow I think the pandemic has brought this so much to the forefront. So I know that when it all started in March, it was always in the context of the pandemic that we were talking about resilience. But the more the times passed, I think we're talking more and more in the context, of generally in life, what does resilience mean? So in a late term, I guess, we've all heard that resilience is the ability to spring back, when one is faced with adversity. Everybody's heard this perhaps millions of times in different forums. But what is this springing back, right? And I think when I've been asked that, it's brought up the questions in terms of, am I born with resilience? You know, nobody is born with resilience. It's something that people develop over time, and it isn't necessarily inherent. It's a set of behaviors, it's a set of things that you learn over time. And I also hear this in the context of, you know, people are faced with different kinds of adversity. So you may have found an individual who's been resilient in one circumstance, but perhaps in another circumstance, they've not been able to manage that adversity. So so I often hear people saying, "Arey, last time this happened, he was fine. What is it this time that he's struggling?" So I think it's very important people understand that the same individual faced with different circumstances may not be able to be resilient, but again, similarly, you may have experienced a similar event in the past, but the same event repeats, you may not be able to be resilient. So I think it's important as mental health practitioners that we are aware that just because you've had somebody who's coped in the past, that they'll be able to do the same each time. So sometimes it is about reiterating what's happened. The other thing that I think we often forget when we talk about resilience in adversities is that our mind reframes, reprocesses things. So if, let's say, you've had a physical trauma, you're able to think about what happened. You know, I've had a surgery and I had terrible pain. I had terrible nausea with this medication. But let's say there's been an emotional trauma and people have recovered. They forget what it was like, you know, what was the emotional response. Sometimes all they remember is, I had a really hard time when I lost my father. And I got through it. But they sometimes forget that, you know, it was still hard. Those few months, you know, they had to stay with a certain emotion, and that's how they recovered. So I think resilience is also about reframing, reprocessing, and not necessarily forgetting it.
So if I can look at the key takeaways, so I would, you know, from what you're saying, resilience is something that we learn. It's not something that we are born with. Again, the thing is that we might be resilient in one circumstance, but it's not necessary that there's a carryover that can happen. And at some level, we need to process what's happening to us in order to really understand and then make linkages, I guess. Cheta, would you want to take that forward?
Yes, thank you, Sujata. First of all, I just want to thank you for having me as part of this panel and for having this conversation on resilience. I think so often we are engaged in conversations on what is not working, on pathology, on a very deficit sort of a focus. So having this conversation is really important. And I'm sure there are a lot of people who right now want to hear about and understand this idea and try to make sense of it, what it means for them as well. So there are essentially two things which I'm going to sort of build off what Soumya was really saying about this whole idea of resilience, which she introduced as a very dynamic idea, that it is different at different times and it is different for different people. But just to add two layers to this, Sujata, if I may, one is, you know, this whole conceptualization of resilience, saying that there is definitely some risk or some adversity or some difficulty or some challenge which, you know, is something we are experiencing. Whether it is something which is acute, which is, you know, a big event which has happened, or whether it is some chronic, ongoing, continuous event, there is definitely sort of a background of an adverse situation that helps us to see this resilience. The other is this aspect of outcome in resilience, that, you know, what happens when someone goes through an adversity? So is that person able to stay on their trajectory? Is the person able to continue to develop and grow? Is the person able to have a sense of well-being? Is the person able to think and feel in ways that are adaptive, which is why it's sometimes called positive adaptation. But when people unpack resilience, what they found was that between the risk and the outcome is what is the process. That what is that mechanism which is allowing us for, you know, for us to maintain that level of equilibrium, to be able to stay happy and healthy and functioning and continue to grow despite what has occurred. And these processes take me to the second point that I want to make, is that people have recognized that these processes are a beautiful sort of a synergy between the person and the environment. And people call it sometimes the tensions, sometimes people call it, you know, one thing feeding off the other. But people have now identified these processes, research, and it's amazing to see how research has converged on exactly some 4 or 5 of these processes. And maybe, you know, as we go forward in the discussion, we will, speak more of these processes. But what I want to sort of harbor or labor on is the fact that these processes are something that come alive in the interaction between the person and the environment. So the ecologies that people are part of, and which is why I think we are having this conversation, that workplace is an ecology. How will that help or allow for these processes to unfold? So I think these are two things to sort of start the conversation that I would like to say, Sujata.
Thank you, Chetna. However, would you want to take that forward? How do you see it?
Yeah. Thank you, first of all, for having me on this panel and for this wonderful week-long endeavor, which has reached so many people. I think it's something really worth applauding. But just to pick up from what Chetna said and Soumya said, definitely we've heard a lot in the last 6 months about resilience. That word has kind of, been played on everything from TV screens to newspapers to anything we pick up in the day. Because I think we are now in a place where we are experiencing, all of us together, something that's leveling us off in the same boat, or maybe different boats, but around the same world circumstance. So we all are in our own way learning and living what resilience is and understanding it. Maybe we've gone through life situations in the past that have helped us see that we have been resilient, but we didn't really put a term to it till we now are faced with a worldwide pandemic, and we understand now that we are really growing and changing. So just to pick up from what Chetna said, I think it's a lot about adaptation. For everyone, it would be different. No one really adapts to a scenario the same way. There's no cookie cutter way of adapting to it. And I speak from some of the experiences I've had in working with natural disasters, such as the tsunami and the earthquake. And I see even there, the resilience is very different. Though we may see people, 100 people together who've gone through the exact same experience, each one carries back their own way of reframing that experience in their mind. So resilience is really quite individualistic. That's the way I look at it. But if we look at the larger picture and the studies and what people like Seligman have to say, we really have a normal distribution curve when an event happens. So we have a lot of people who bounce back, spring back, as Soumya said. They all fall within that normal distribution. Typically, an event happens, they experience a lot of difficulty for a few weeks, and then they come back to their state of being. Some people go on the one end of the bell curve where they may develop stronger reaction to that event or adversity. And we see that among the people who are more at risk for developing mental health issues. And then on the other end of the spectrum is something which both Chetna and Soumya spoke about, and that I see as a kind of a growth that comes from that trauma, a post-traumatic growth, if you can call it. Some people call it like developing a hardiness to deal with future scenarios. That's, I think, the beauty of the human mind. It not just gets desensitized to an event in the future, but it also reframes that entire event and develops neurons and develops brain pathways that help to cope with that in the future. Whether it's a similar event, whether it is any hardship in life, there always will be a reference point. I could do this in the past, and that's where I'm growing now in the future. And it's that beauty of the human mind that many of us forget. We all think about moving on, moving forward. We don't understand that we carry so much with us, which makes us so resilient in the future. That's why anything that happens, we often look at it as a very negative discourse, and we have to look at it perhaps in terms of what is it going to make me change about myself. This is an opportunity, and are there some things about myself that I will discover which will give me something more than resilience, which will give me the ability to cope with similar issues in the future. So that's the way I look at it.
Thank you. I think that really helps with giving multiple perspectives. I'm going to add on a bolt-on question to what I asked earlier. What is the role that culture has in terms of making us understand resilience? In terms of, can we say that there are cultures which foster resilience more as compared to others? And again, with if you can emphasize more in Indian culture, looking at what we do in India to foster resilience. So whichever order, whoever wants to start first.
I guess when you think about
Yes,
culture, context, there are certain, I guess every culture has certain behaviors, rituals, traditions that foster resilience, but equally there are certain traditions which may hinder it as well. So when you look at loss, when there's a death in the family and the rituals that follow, a lot of them in a way are geared towards building some sort of resilience. So when you talk about resilience, you talk about a set of behaviors. You do it in a mindful way as a way of managing. So there are certain things that are inbuilt where resilience is fostered. So I know you've lost a lot, but let's do this. It'll give you something to hold on to. This will help you ground, because this is one of the hardest points. And if you look at what happens, there's a lot of people that come around, family and friends, in the first few days, be it from a practical point of view or from any other point of view. So I think there are certain cultures in communities where resilience is fostered through certain traditions. But I suppose it's also certain cultures and traditions where it's not fostered. There's a barrier. For instance, I often hear in our context, when you see somebody upset, the immediate response is, why you have to be strong? Why are you crying? If you're not strong, what will the rest of the family do, or someone else do? So there's a sense that certain things easy to hold on to in the face of adversity, but some things are hard. They see somebody crying, it's hard to hold that emotion. So I think it's a hard balance to strike, I think, in cultures.
So there are things within cultures that encourage resilience, and there are also things within cultures that do not foster resilience. That's what I'm hearing. And again, if we unpackage Indian culture, you can see things where resilience is fostered, and similarly things where we don't encourage resilience. Chitna, maybe you could look at some of the things where resilience is not encouraged, with specific focus on the Indian context.
Yeah, no, I think this is a very, very interesting and important question for us to really look at, because, and there are two parts to it, Sujata. One is like, what is that process that we are looking at, and whether the culture that I'm part of is whether it's hindering or, like you're saying, fostering that process. And I'm just going to label a few of those processes and then maybe come to what really then comes to hinder. So, a couple of things that we know that, whether it's access to resources, whether it is, a sense of identity, whether it's relationships, and the whole idea of cultural adherence. These 3 or 4 factors or processes are very, very critical to resilience building. And we know that. Now, the context that we are part of can really play a role in this. And I'm going to use something that Sujata often uses in class, where she says there are cultures within cultures. So, it's not such a simplistic idea. But at the same time, I do want to say that underlying all of this is this whole idea of whether the culture that I belong to fosters relationships. Does it allow me to have a sense of belongingness? And I know that that is one thing we do really well in our culture. So supporting, caring, attuned relationships. There is someone who is watching you who will say, कि, आज थोड़ा सा कमजोर लग रहे हो, आज लगता है सोए नहीं, आज क्या हुआ स्कूल में? That attunement that someone has in our culture is a huge strength, because that becomes a way, to foster resilience. But at the same time, if we look at some other aspects, which include the development of a sense of self and identity, sometimes that might be compromised because autonomy is not fostered in certain situations. And if I take it to a larger context, which is about access to resources and being in a just and fair world, that becomes really complicated, because there are definitely contexts which divide, which marginalize, where resources are not fairly distributed or equity is not happening, which then has an impact on the psyche of the person and then impacts the process of resilience building. So I think that is something which in our particular context, we have to be really aware of. Issues of gender, issues of other forms of, practices which are not diversity affirmative, which can then lead to more marginalization and then impact the resilience processes. So issues of power and control, that might really be important. And I think I just want to also emphasize what Soumya said, because I thought that was really important about these cultural beliefs and ideas and values, because I feel that a culture determines what is that resilient outcome, and that adherence to mechanisms and processes which a culture values can really be very significant. So if we bring it to the workplace context, I think what that culture is, who is seen as that person who is high functioning, and what it takes from me to be able to be that person, that can really change the discourse. You know, I mean, I would sort of highlight these things. I mean, of course, there are many aspects to this, but maybe in a nutshell, this is what I would like to say.
Thanks, Chetna. I'm also hearing a word which the subtext relates with issues of inclusion. So if there is inclusion, we would also have, foster resilience. However, would you like to take that issue of inclusion, inclusivity, resilience, and the workplace together?
True, and just a little, to borrow from what Chetna said, what comes to my mind is the resilience of cultures like ours, which have really grown up around family dynamics and about the neighborhood and about the ecosystem. A lot of our resilience came from that. And if you look at, the latest initiatives that are done by the government, when they even go into the rural areas today, we hear so much about the farmer suicides, we hear so much about problems, but we don't know that they are very resilient communities also, apart from the fact that there are these pockets of disturbance that exist. So actually, as a community and as a country, as a nation, we always came across as very resilient because we had so much support. I'm supposing that has somewhere or the other watered down with the influences of so many other things that have come in, the urbanization, the nuclear families. But if we go back to the roots, then the resilience really comes from the community, and that still is present in, at the grassroots level, somewhere there. So we have to sometimes go back to that and then bring it to all, the journey that we have made, the development that we have done as a nation. And if we come to the community we have now, say at the workplace, then what can we use from what we have and what we know already rather than borrowing from somewhere else, and use that to continue to be resilient. So if the workplace fosters and recognizes that the root of all resilience is not just the human or the individual coming back, but it is an additional factor there, and that is the support that that person receives from around, or the stigma that the person receives from around. That's a factor which perhaps we always want to close our eyes to. We don't want to think about, because we say, oh, this is an individual problem, let them go and take help and sort it out, this is not really my issue. The fact is that whether it is mental health at any level, individual, community, and organization, it is 1+1. That is the individual plus the social support, the individual plus the community. What is that community doing to foster that resilience? When I walk into the workplace and say that I have a mental health issue, is that something that is looked at and accepted, or is there a discomfort around it? There itself, we can start building a sense of community. If we change our way of looking at it, if we look back at, the way that mental health, we didn't know that there were mental health issues maybe during the times of our ancestors, and so many mistakes were made when it came to mental health issues, but there was community. There was a sense of, I understand. There was a sense of, okay, there's something that's gone wrong in your family right now. Let me see if I can help out. That's what the community did. And that's a little which we have to borrow from our roots and bring it into the here and now, the today, the organizations, what we call as the developed world. So I think that's where we should be heading, back to our roots.
I have a question that's come from the audience, which I must ask. They've talked about survey findings, which reveal that when it comes to providing supportive environments critical for mental health, 27% of employees reach out to HR persons, followed by a third-party expert. What is the action plan and way forward to foster and strengthen emotional resilience of employees at the workplace? That's the first part of the question. Second part goes on. Secondly, now that we're all stuck at home in WFH mode, how do I foster resilience among my near and dear ones? Wonderful question, I think, which carries a lot of things that we're talking about, but let's try and address it directly. However, would you like to go first on this?
Yeah, I think That's an excellent statistic this person has brought up. Managers and the HR are the first source where people approach, and that's natural. In fact, in the recent with the pandemic, that has become even much more. The truth of the matter is that perhaps the mental health issues that were lying below the surface, with a world, let's say, disorder that's happening, everybody has started understanding that there is a problem now which was lying undetected so far. So firstly, there's going to be a lot more of this at the workplace. And managers, the HR colleagues are going to witness much more of mental health issues or people talking about it, because now it can't be kind of kept below the surface. So that's the first thing. There's going to be a lot more talk about it. The question is, like I said, it's 1 plus 1. When a person talks about it, what does the opposite person do to react? And that opposite person can be the manager, can be somebody from the HR, the person can be a colleague or a junior. So what is the reaction that they are having is very important, because if the reaction is of hesitation, of not wanting to reach out, or if the reaction is of awkwardness, then that individual is definitely not going to bring up this conversation again. So the first is, what can we do to make those changes? The second is, what can you do to foster resilience in the people around you, in your own home? Is you be that person to talk to them about this, because the awkwardness, the need to reach out is there, but the need to talk about it has to be equally strong. And I think
for me, the
need to
concern
want
is it's only this 27%. For that for me is a very big number. I mean, it's only 27% that's reaching out to talk to somebody. So what happens to all the others? So that's, I mean, for me, there's this
that's another big
huge 70-odd% which is not reaching out. So what can we do in terms of, getting more people, to reach out? So Soumya, may I hand the discussion over to you?
I was just going to add to that point. So the 27% are reaching out to the HR. It may be that the other lot are reaching out to some other community, or they have some other resource. So it may be that they are finding, strength, resilience, or some kind of comfort in some other source which we are not aware of. I think just for, kind of tagging on with what Habovi was saying, when people reach out to you in organizations, it's about listening with an open mind. So I think sometimes, there's this concept of mental health champions in organizations. So I think they come with that sense that they should know the answers to everything. So somehow I think they take it on themselves to fix a problem. So when you have an employee or a colleague reach out to you, I guess the first step is to just listen, be curious, and not assume. A lot of the time, we jump and say, oh, I've lost somebody. If somebody's talking to you about loss, you might feel tempted to say, I've had this similar experience. So it becomes very much about the other person and not the person who's actually got the problem. So that may be another reason why a lot of people may not reach out as well. So I think with HR or anybody, be it in the family, when somebody reaches out, don't assume. The other thing in terms of emotional resilience is to be able to listen about an emotion. A lot of the times, the individual who's going through an adversity or a stress is not able to name it. They're feeling frustrated, they're feeling a host of different things. So sometimes it may be okay for you to, contain yourself and just listen. If somebody's upset, they are upset. They've had a really bad day at work, or your son's had a really bad day at school. He's upset. You just have to let him be upset sometimes. Only then will he be able to think about the next steps. So fostering resilience sometimes may be about you holding off the temptation to fix things for other people. But equally staying with a difficult emotion, letting people be.
Stigma?
I think this discussion is really adding to, what we want to really also sometimes in ways communicate as mental health practitioners. That one is, what do we do when someone reaches out? The other is that there are certain prerequisites that will ensure that people reach out. And I think people reach out when they feel safe. So this whole thing of psychological safety or emotional safety is a climate that gets built not only at a time of crisis or distress, but it's something which is sort of present. That will actually allow people to reach out, because if I'm going to sort of not feel safe emotionally, I'm not going to reach out. So what is it that we can do as parents, as spouses, as partners, as leaders, is how do we create a safe, supportive space such that people are able to reach out to us at times and express what's going on inside them. The other is that, and this is something that we know, that when people are not regulated or feeling distress, the presence of another live brain which can co-regulate them, which can soothe them or comfort them, is what people seek. So if people have experience of us as people who are regulated, who are calm, who are able to manage things, if we are able to model some of that, then there are greater chances that they will seek us during times of distress so that they can calm down in our presence. So I think that's another very important aspect of what might actually facilitate people reaching out. Psychological safety, knowing that the person that they are approaching is also going to be able to co-regulate them, and in their presence they can feel safe and comfortable. And we also know that when people reach out to us at times of distress, I think like Soumya pointed out, that what does help is if we are able to regulate them emotionally or stay calm during the moment rather than rush into a problem solving, because that part of the brain is really not active at that point in time, is to just help them stay emotionally calm. And once that is taken care of, the rest will follow automatically. I think these important messages that have come together in what Havovi and Soumya have pointed out, I think are really, really key to maybe this question.
So I'm going to ask you, in terms of very specifically, what can organizations do? So one is, I've heard this thing about mental health ambassadors. So having a mentorship program, having, ambassadors. What about things like having mental health policies in place? Would that help? And what should organizations do in terms of having a mental health policy, which they also advertise? Because I'm not sure about how many organizations actually advertise their mental health policy, if they have one.
Yeah. So, is it
yes,
for someone?
Yeah,
I think, it's very important. I've been seeing the discourse on various social media platforms that now a lot of people and organizations are taking, mental health first aid training, psychological first aid training. They're understanding now that these are resources available not just to mental health practitioners, but to the whole world. And they can be hugely helpful. For example, if a manager suddenly is faced with an employee who says, I went back home yesterday and I was having these really dark thoughts, and hints at perhaps something very deep. What is that manager supposed to do? How will he react? The first thought that goes in his mind is, this is a professional's job and I can't do much about this. This is not my area. What we understand and what I've also seen is that there's a lot of helplessness in organizations in terms of what can we do, because we are not the trained people. So can we send them to a mental health professional or to an EAP resource? But what we need to understand is we as humans, even without training, can do a lot. And if at all training is what is required, that training doesn't have to be very long term. You don't have to do a degree of 2 years in order to get proficient in terms of how to talk. So if we allow accessibility of all of this, rather than just soft skills training programs in the workplace, very definitive programs that focus on, how to be able to talk to somebody who has a mental health problem as a first aid resource, because we know the world is moving towards that. We know for a fact that it's only a distilled portion of the population that reaches a psychiatrist or a psychologist. The first responders are people who the person is comfortable talking to. And who are these people? They will be the manager, they'll be the HR, they'll be a doctor, they'll be a nurse, somebody that they are seeing, and feel emotionally connected to. So like Chetna said, the safe space may be you, maybe where you are sitting right now. And you can make it a little safer if you have the skills and capabilities. So I think firstly, across board, all organizations should start training their managers, training their HR professionals, not just in leadership skills and all of that, but how to approach uncomfortable issues. Like when we had the discussion on suicide and self-harm, we spoke about how these particular things are stuff no one wants to talk about. And why don't they want to talk about? Because they feel helpless. They don't want to talk about it in organizations because they feel they lack the ability to be able to approach someone like that. It's emotionally distressing. So maybe empowering ourselves in that sense would be great. You know, certification programs can be made mandatory in organizations. And these certifications are not difficult to take. They are sometimes 1 or 2 day certifications. But the amount that is taught can really help people at higher up levels in organizations to feel a lot more capable. And the accessibility of mental health care is also to be there. It's not just managers who are supposed to step in and start doing the mental health work, but they need to have a resource present in the organization that will provide that space in case the issue of discussion is something which is really risky. And that is also something I feel organizations need to be able to have. Not just an HR and an L&D department, but a mental health department that has psychiatrists, psychologists present there. So that's something that I feel is important.
Soumya, would you want to take that forward?
Yeah, while Avovi was speaking, I was talking about how this is addressed in different parts of the world. So when I was in the UK, I worked with one of the largest health providers in the world. I mean, it is the largest health provider, the NHS. And how we dealt with mental health, I saw it evolve in my trainee days till I became a consultant. And I guess that is what it is going to be. It's going to be dynamic. You know, how do organizations implement these policies? But what struck me about what we said is it has to be made mandatory in the initial phases. It can't be, you know, you have a choice in it, and there can be, there can be modules in it. And every person in the organization needs to be sensitized. I often found when, especially when I was working the NHS, the people who would talk to people in stress were often the janitors, the domestics, people who hung around after 5. They were the ones who noticed somebody in distress, and they'd be like, "Hi, love, are you okay? Should I get you a cup of tea?" And they'd listen. Okay, so I feel like sensitization can happen or should happen at all levels in an organization. Because sometimes it's less threatening for you to talk to a colleague or somebody that you don't like, you know, Chetna was saying, you may feel psychologically secure with. And it has to be mandatory, it has to be written into it. And we need to have refresher courses. So I have organizations that are great at starting these, and they'll be like, you know, you're a new employee, let's teach you all about it, and then if it's all forgotten. We have to remember that the human brain needs to be reminded constantly. So you need to have refresher trainings once a year, every so often, and integrate that into your appraisal process. Because unless you do this, people are not going to feel inclined to do it. And as you go higher and higher, the complexity of people you're going to be dealing with in terms of any kind of difficulty is going to be higher. So the kind of training you do might also need to be contextualized. So maybe at senior manager level, the kind of mental health training or awareness training they need may be different to what a junior manager might need. But it has to be written. And I think the first step is for somebody to start writing. The second thing which you said, which really sits, you know, I thought was very good, was it has to be made publicly, you know, publicly available. So if it's on a website, that's also a way of promoting inclusivity. If I'm a prospective employee and I look at your website and it says we have a mental health policy already, so I know that if I've had depression, I know this employee is going to be empathic with me, and that's also a way of fostering inclusivity in organizations. But so we used to do the equality and diversity training and mental health training in NHS, and at every level you have to do it as part, you know, every year we have to repeat it. So I think if organizations are listening, I think this is a key point for them to take away. But
yeah, I think this is a great panel for us to be talking to also, because I think, you know, we are ideally situated to inform people that, look, this is something that, you know, it's a message that we need to repeat. It's something, you know, we have a movement started, but we can't afford to stop. It needs to be taken forward.
Yeah. And it's not going to be perfect when you start. And we have to take into account the cultural context. What applies somewhere in a certain type of organization may not apply in another. So you do contest, but you have to start somewhere.
So I'm just going to bring together what Havovi and Soumya said, and I'm going to sort of say that what has helped us while we've been looking at systems to promote and prevent mental health concerns is to look at it at 3 levels. And the base level, which is the promotive aspect, looks at all of these aspects of, the culture, the climate, the policy. Do we have policies which are inclusive, affirmative? Are we ensuring that there is a climate where everyone feels safe? Is mental health one of the goals? Is it part of the larger vision and mission of the organization? Because the thing is that we need to recognize that workplace organizations are also working towards achieving certain outcomes. And in achieving those outcomes, what happens to people who are in that organization? How do you balance that? If we want to maybe generate revenue or we want to achieve certain targets, there are certain processes that we are trying to put in place. And in that, how do you still keep taking care of the people who are part of those systems? So this is something that needs to be part of the larger, the leadership team discussions, the policies that go in. And how does this get transacted on a day-to-day basis in terms of practices that are non-discriminatory, practices that foster a sense of empowerment in people, which allow people to get a sense of belongingness to the community, the organizational community, because these are all things that will foster resilience. If I have a sense of agency in the organization, if I feel connected to the organization, if I know people care, then I'm going to be a lot more committed and I'm going to sort of really thrive in that organization. And then comes the level 2, which is, really about responding to distress. But I also think there's another component in this, which is about awareness and stigma reduction. Because very often people might be experiencing distress, but they might not know what this is. So it is the responsibility also of organizations to ensure that there is awareness, that information is available. People are able to, without any stigma, reach out and find out more about what can be done for their own wellness. So more wellness conversations, more conversations about awareness. And then what I think Havovi was saying, that this ability that people around me are equipped with certain skills and resources to be first responders. They know what to do if someone expresses distress. I feel a little more equipped as someone in my team that if someone comes and shares that they're feeling really stressed, I know what to say. I have the words. Sometimes we might not have the words, that if someone is expressing loss or grief or distress, what do I say? How do I say it? Is it okay to say these things in an organizational setup? Am I crossing boundaries? When is it personal? When is it not? So if there is some way or some platform for dialoguing this, then I will know that, I'm not crossing any boundaries. It's okay for me to say these things. It's okay for me to offer this nature of support. If, like Soumya saying, if that can be integrated into leadership training or team building, then these conversations become much more open. And then, of course, it's a third tier where, if there are specialized services that are required or people require specific care, then does the organization have a system in place to be able to provide that for them, which is what, where EAPs come in, where like having a mental health department comes in, where, liaising with experts in the field comes in, and creating spaces to, have access to that also comes in. So I would sort of say that these 3 levels can somewhere look at a much more holistic, integrated response from an organization rather than just a quick fix strategy, which might or might not really address the whole issue. So, yeah.
Thanks, Chetna. I think that's really thought-provoking. I think, what organizations can do and should do in terms of at least developing, these 3 layers, very useful to look at. Soumya, I think we cut you off. Is there anything else you would, I think you wanted to say something else. And
no, I think Chetna covered it. I was talking about how leadership teams need to take some ownership in this, and because often it's people who are higher up in the organizations and it's their attitude towards health and problems that somehow trickles down and dictates how other people respond to the same thing. So if I'm a leader of an organization, the language I use when I see somebody in distress is very, very important, even in casual conversation. So the more flippant, the frivolous we are when we are talking, someone else is observing us, someone else is listening to us. So it has 2 effects. One is if they're in a problem, they're less likely to come out and say, hey, I'm struggling. Equally, it may become okay for them to discriminate or stigmatize against someone else in their team going through something. So I would say people, leaders of organization actually have a huge role in terms of taking this forward. in terms of everything, I would say.
So modeling the right kind of behavior, walking the talk in many ways, I guess, to use management parlance. Now, there's another question actually which has come from the audience. I think this is something we really need to think of. Employees may feel threatened. Anything related to mental health may result in employees fretting that they will lose their jobs. How do we encourage them to come over and talk to us? And how do we ensure confidentiality? I think these are huge issues because, again, I think on the one hand, right now, especially given the crisis, there's so much that is, going in people's heads in the sense, what happens if I, talk about vulnerability? Am I going to lose my job? And again, at the end of the day, what's going to happen to this information that I'm giving across to this other person? Who may be a colleague, who may be a superior, what happens then? Chitna.
I think this is a real concern, honestly. And I think for me, this is not something which is a concern which, once it comes up needs to be handled. And I think I've been harping on that issue that these are all proactive measures that need to go into place. So if there is a frame that is created by people are clear about, what are the spaces, what are the avenues, how will this information be used? And if there is a clear guideline set right in the beginning, these things can actually be taken care of very easily. Because as mental health practitioners also, we ensure that there is a frame. Because the greater the ambiguity, the greater the uncertainty, the more anxious someone is going to be. So the idea is if we can create some structures in place, if there are certain protocols, if there are protocols for maintaining confidentiality, and I'm going to link it to what Samya was saying, that if I have basic trust that this information is not going to go out, and if that can be said at the beginning of the conversation, where the person is not left wondering what is going to happen to the information that I'm going to share, it will really open up channels of communication. And the idea is that we're not trying to open up channels of communication for the sake of being intrusive. We're trying to open up channels of communication so we're able to understand people's situations and where they're coming from and what they might need, so that we can be much more responsive as colleagues to them. We can be much more supportive, we can be more responsive. And if that is also maybe explicitly stated, what we're hoping out of that conversation, what perhaps can we do to perhaps support them. I think the person will have a clearer structure of what the motivation for having that conversation is, how that information is to be used, and how that person will tie that back together. So I would think that this would really be part of a lot of the training that we've been all talking about the mental health ambassadors or first response training. But how do we handle these conversations also? So I think that's where I would
well, I'll also add another layer to this, which I hope you'll be able to also address. The fact that organizations today are now largely concerned with the bottom line, which is the profits. Say that they're answerable to shareholders. So where do we, talk about, how do we talk of people who are mentally fragile, vulnerable? Is this only the land for the brave? Are we going to ignore the ones who are vulnerable because of the fact that at the end of the day, it's after all profit? Samya, let me answer. Let me throw that question at you.
I've been asked this a few times, so I work with an organization called Razorpay, and we're providing, and this is a common thing that comes up, that all the organizations are under pressure. They have to perform, they have targets. So the short answer to that always to them is fix the problem now. Figure out a way. So you're the leader in the organization. Figure out a way to fix it. But when you fix it, the thing that don't let the mental health aspect come out in a negative way. So let's say you have an employee who's struggling and who wasn't able to deliver. Make sure that whatever needs to be done is done, but be empathic about the struggles they've had. So often what happens is that the problem is solved and the mental health aspect of that employee is blamed. So that's a way of destigmatizing and helping the employees as well to get through. The second thing I find is employers need to remember that a difficult employee is often an employee in difficulty. So if you take that approach, the way you might deal with them would be completely different. Because when you're in that leadership role, you know how to get work done. So often I find that it's not the work that causes. The employers also have an issue. There's resentment there that, how can this person not do this piece of work? I'm working so hard. Why can't he do it? So I guess the minute you step back and think, actually, this person might be struggling, the attitude might change. And from the employer's perspective, often the temptation is to say, why can't you do this? You've done this before. So if you're able to use more neutral ways of asking, your employee may be able to manage that. How can I help you get this done? What aspects of these are difficult for you? And again, this becomes, like Chetna was and Habovi was saying, part of the policy making as well as the training aspect of things. The other thing is also to not expect change to happen too soon. So I find that organizations, because when they're under pressure, they will implement certain good policies, but they take time because people take time to trust these things. So you might release a confidentiality statement saying, whatever you tell me, I'm not going to talk. But people aren't going to believe that straight away. They might take months or even a year or longer to be able to trust an employer. Why should they trust you? I think you have to be patient when you implement policy changes, like, especially related to mental health. So I would say that's the key thing, to be able to hold on to people and not just, get rid of it. So that's what happens. So it leads to a problem of excluding them. So somebody's struggling, they weren't able to perform, and they are made redundant, and soon the word gets around. So I guess the way to do it is to try and be as inclusive as possible.
Abovi, you want to comment on that?
Yeah, I was, I was just reading a lot of research around mental health. Actually, I want to bring in 2 points. One is on mental health inclusivity, part of which is when a person comes into the organization and then talks about their mental health problem, that of course leads to its own level of issues. And let's be straightforward, we have had people who've told us that they do not get promotions, their appraisals come to a standstill because they've revealed these problems. Now, I'm part of a community called Bipolar India, which works primarily on people with bipolar disorder and their inclusivity in the workplace and their problems in, acclimatizing to the basic ecosystem that we have. And many of them mention that they do not want to reveal, and they don't want to for several reasons. One is, of course, their their higher up growth is kind of stopped, but it's also about how they are then looked at as people who can't handle things. And there's more than enough evidence to show that employers will take in someone who has a physical disability, because of course now we have the Disabilities Act across various countries, even in India, but they're not likely to employ somebody who may say they have a mental illness or who are on the autism spectrum, for example. They're not likely to take these people into their employ. They may not say openly that they're doing it, but that's what happens. Now, that's why I feel it is very important for employers, for employees also to know they have rights. And these rights are now legally available to them with the advent of the Mental Health Care Act. Although nothing has been openly said in the Act about organizations, there is information about confidentiality. There is information available now in the Act that states that you cannot discriminate. And that is the purpose of this Act coming in after so many years, right? We have a change and a revolution with that Act coming in to provide that resource to the mental health, to people who suffer from mental health issues, to recognize that their rights are as much as anyone else, and they cannot be discriminated on this basis. So it's time to take stronger stand. It's time for organizations to take onus, to take responsibility. I had, in the early part of my career, worked with several organizations as a coach and as a leadership coach and a lot of those things. And one of the struggles I always faced was in helping them understand that you can't put a group of 20 people in a room and talk to them about, say, self-esteem or about assertiveness and expect them to take that back with them. They will not be able to put that into practice unless there are policies and there are methods to discuss issues at a much more individualistic level. It can't just be about let's mouthpiece this information about how they should be stronger and hardier and bounce back at their work and do a great job and rise up to leadership positions. All this is important, of course, because every company is looking at return of investment, but your biggest investment is your employee. So where are we investing in that? Your biggest investment is the person working with you, not, and if they want to do good work, you can't just chuck them out or not give them an appraisal or not put them in a promotion because they're not doing good work. You've got to figure out why they are not. And you probably will have a brilliant performer at the end of the year if you invested a little more in understanding that person. That investment is hardly anything. It's a few minutes of your time, maybe a little bit of connecting with them with the right resource in the company. It's about building a team of people, as Chitna said, starting those 3 layers until you reach the top layer. At least at the bottommost layer, see what are the policies that you can put into place for, for inclusivity, for making sure that gossip is not something that happens in companies, and you're putting a full stop to it if it happens. If someone comes and talks about in confidentiality about suicide or something that's happening in their family, let's say a problem with their spouse, these things are mandatorily not made, not discussed outside, because confidentiality is not something that just a mental health practitioner holds towards their client. Each of us as individuals have to have that accountability. And so, making them aware, making everybody at organization levels aware about legal rights, aware about policy change that's happening at a government level, very important. I think missing also. And that's what I have to say.
Yeah, because I think that doesn't happen. I don't even know how many people, how many organizations are aware of the Mental Health Care Act. And,
that's
and what the legal implications are. And again, but at the other level, I would also wonder how many employees would be willing to, take recourse to the Mental Health Care Act, because I think that's where it would, it's like a double-edged sword. I mean, in the sense that would you want to use the legal recourse? It's probably the last resort.
I think it's more about just being aware. It's being aware that just like the Disabilities Act happened so many years ago, and now we have a little more in terms of inclusivity, it's going to take years for that inclusivity to come in mindset. It's not just about, the employee throwing, there is this act available and this is what can be done with it. It's about the mindset changing, which can happen if there is a firm ground for people with mental health issues to stand on. Just like we develop a firm ground for various other things. When it comes to other situations in organizations.
Chitna, you want to pick that up?
I think I'll just build on what Havovi was saying, because she's really touched on a very, very important issue. And I think this panel is actually trying to achieve really that, about advocacy. That advocacy is a step. If we are looking at any kind of systemic change, first is, some of these things, if they can be put out there, if people know about it, and if there are advocates, people who are able to bring up these issues, only then some of this change is going to happen. So I think, what you brought up, Havovi, was really critical in this. I'm just going to add something at, to one more strand to this, is to say that when we're looking at systemic change, it also means that each of us need to go back and reflect on what these biases are that we hold, what are the, internalized sort of ideas that we have about these situations. And I think unless we unpack that, the larger discourse is also not going to change. Sometimes we have a tendency to say that, this is not happening with me, it's not happening in my team, it's all something that happens outside, somewhere else. But the truth is that in our own ways, if we can also deconstruct a little bit that how we use power in our relationships, how we might, look at gender, how we might be looking at people who are, do we also are ableist in our ways of thinking, that who is contributing to my team, who is fitting in with my goal. And I think what Soumya said was so important, that if I have an agenda, people who fit into my agenda, it's very convenient. If someone is not working with me to get my goal, then I get frustrated, and then it becomes about excluding that person because it's not helping me. And I think, this is a global problem. We are talking about compassion at a global level, that, as human beings, if we keep making it about ourselves and my goals, those goals will get frustrated, and then people are just objects. We are just whether they fit in or they don't fit in. And it really means to sort of step back and think and take a position of compassion, that, compassion towards ourselves when we are going through challenges, and compassion towards people who we work with and we live with. I think, it does mean sitting back and thinking about these aspects. So
So I have a question actually that had come up in one of the other panels, and I really want to throw that to you. I really would like to get your perspective on it. And it related with, organizations have EAP, okay, and how do you get people to use the EAP? How do you, why is it that I have an EAP program going, but people aren't using it? What is it I need to do to get people to use the EAP program?
I'm sorry, I lost it.
Sorry, I'm saying that many organizations have employee assistance programs, but these don't get used. Why is it that, people don't use the EAP? What happens? How do you publicize the EAP more?
Yeah.
Yes, Abhi.
So, yeah. So EAP programs, I mean, with the tie-ups I had with a few of them, I know that it works both ways. We've talked about employees or people with mental health issues who step forward and approach in an organization for help, and then they are directed to an EAP. And I would say a lot of organizations take proper care there. They really try and see that the EAP provider first has only a simple talk with the employee, and then they kind of link them up to a confidential therapist. So there's a lot happening there. But let's talk about the other side of the story, which is when the help is offered, help is still not taken. Help sometimes is if people with mental health issues or people with basic stressors also find it difficult to reach out for help. That's the basic stigma, right? Again, it's an issue that we all have to work with in changing mindset around mental health discourse as a whole in the country. If help is offered and help is not taken, that also speaks a lot about where we are going and what our mindset still stays at. I remember there was one particular company that I think did a lot for their employees, where there was a suicide at their workplace, and they had asked me via. So nobody in the company knew that I would be there. Who is this person there? But I was engaged there for an entire day, and confidentially the employees would come in and talk about the death of that co-worker who had died by suicide. And this was open to the group of few people who were affected by that death. I sat there from morning 9 a.m. to evening 6 p.m. and not a single person showed up, although the resource was available. So this works both ways. It's about not just resources being available, but are they being taken? So what can we do to make that better? I think it starts at the complete ground root, which is opening up discussions. Not a simple thing like you pass a meme via WhatsApp on mental health. You're already part of a discourse that is stigmatizing. So a lot of things that have to be done, with thought to them about standing up. Whenever we stand up and we talk about body shaming, and we don't want people to do that. We talk about skin color. We have to start making discussions around mental health also that normal, that much a part of our daily routine, that it's not okay to talk about mood swings as bipolar disorder. It's not okay to talk about having a blue day as depression. We have to be able to make this part of our vocabulary. So it has to start there. And that has to be done at, the organization is a one system, but I'm talking about a much larger ecosystem. That's our country. And that's where it has to kind of seep in. That's when help giving and help taking will be in some kind of a balance. That's how I look at it.
Samya, what do you want to take that forward?
Yeah. On the note of, how do you, so when people come to work in organizations, they've been through other ecosystems before they come to a work setup. So they've been part of schools and other communities before they come. So I think, like you said, sometimes a lot of this needs to be included in other parts as well, in terms of sensitizing people, in terms of what you can say and what is not acceptable. And also when I was thinking about today, we talk about organizations in the context of, say, corporate organizations that are money generating in some way. I don't know if that's the right word, but organizations can be anything. It could be a hospital setup, it could be a university, it could be so many things. So I think whatever we are saying today is very relevant to anything. It could be a school. So a school has many employees there. So I think if you can foster a culture of people being open about mental health and not feeling discriminated. So if a child at school sees that the teacher who was unaware was not discriminated against, he internalizes that. That's a template he holds on and goes on into the organization. So at the grassroots level itself, I think we can start looking at fostering change. So I think we should start thinking about institutions as not just say corporate organizations, but even healthcare ecosystem. How often are we as healthcare professionals guilty of kind of trivializing someone else's problem? I mean, my own colleagues sometimes, somebody goes to them with pain and they'll dismiss it completely to say it's all in their mind. So I think that sensitization needs to happen across the board, and especially the people who are in caring positions, say teachers, healthcare professionals, need to start saying that it's not always hunky-dory. Sometimes things don't go well and I've sought help. So I think that's also a message that needs to, start trickling down to people at the grassroots levels.
That it's okay to seek help. It's not, there's nothing wrong if you seek help. In fact, it's good for you if you do seek help.
Correct.
Yeah. At worst, that way, I think the other are, seriously healthcare professionals. Like at least I think, when you're doing now the psychology training is such that self-care is taught, we talk about it a lot, at least in mental health. But if you were to look at others, people, it's so stigmatized, as a doctor or a nurse, if you say, I have a mental health problem, the first thing is his judgment effective? It's like Havovi is saying, somebody's having a bad day. Oh, he's got bipolar. Maybe you shouldn't be doing the surgery. Maybe they shouldn't be doing it. So I do think that providing spaces in every setup is very important.
And we tend to be hypercritical. We also want to be super. I mean, whether it's super mom or super employee or whatever, we want to be. Okay, and I think that kind of a message is also going across a lot in terms of, you can't afford to take a day off, you can't be sick. And of course, when it comes down to mental health, definitely not. No. So again, are organizations advertising EAP programs enough? I think that's another thing that we could look at. Chetna, would you want to just look at that? And then I think we have another 5 minutes. We'll need to start winding up. I have a couple of interesting questions that I would not like to miss out on.
So on this matter of EAP, I think just one small point, I think a lot has been covered by Havobi and Soumya, but just one small point is that usually when we see someone in distress, it's about, oh, something is not okay with you and something needs to be fixed. People are very alert to these judgments. But I think we need to turn it around a little bit to say that, what is it that I could do better to make this easy? And I think that sort of also helps change the conversation a little bit, that what is it that perhaps the system could do at this point in time. Makes the person who is responsive. And I think if that's the approach that we're going to take rather than trying to say that, oh, you have a problem, here is something, take this and fix yourself, versus saying that, okay, there is something which requires attention and this is a difficult and challenging time. Let's see what perhaps is available that I can do and the system can do to help you through this time. And I think that is a different approach, and maybe we need to think a little bit more on those lines a little bit. How does the system need to now also be more responsive, and maybe that's perhaps going to make this a lot much more collaborative, and the well-being of a person is not the responsibility of that person alone. It is something which systems are responsible for. So self-care has been pitched as you do your own self-care, and I feel like that is something that needs to change. Self-care is not just my responsibility. The systems that I'm part of, the families, the organizations, they are equally committed and invested in that. I think if that shift begins to happen, I think things will look different, is what I believe.
I think we'll take this last question, and this looks at what method should be adopted by schools or parents to develop resilience and well-being of children when schools reopen after 7 or 8 months, which I think is a situation many of us are going to face when we need to think about sending kids back to school. So what could we do? What are some of the messages is that we can give parents to work with their children? Chetna, I'll start with you.
Because she works with schools, so I want to hear Chetna to say.
So this has been there's been a lot of conversation on this because parents and I think teachers are talking about children's motivations, children's attention, children's teaching, learning, and talking a lot about how, they're not so attentive and are distracted or not motivated in the same way, or getting into, gaming or other things or technology use. I think this is like a conversation happening on every platform. And I think, for us within families and as parents to perhaps really understand that these are very different circumstances and each child is figuring out their own way to perhaps respond to that, and not every day is going to be the same for all of us, and constantly that expectation that every day we will be performing in a particular manner and engaging in the same manner is not going to happen. Things will look different. We need to put in supportive spaces in place for sure for children as they are making these transitions, and it is a lot of transition for them, honestly speaking. And as adults, we have many cognitive and emotional capacities to make sense of the world around us. But with children, they might require us to, bolster this process as they make sense of the world around them as it changes. And I think that's the role that we need to play as, key players in their lives, where we are able to, one, regulate ourselves so they are in regulated environment. Two, we are able to open up conversations where they can make sense and make meaning in their own way by helping them with the language that they perhaps might require. And also perhaps to be able to help them, find their motivation and find their attention once they sort of feel that they are in a regulated, safe space rather than rush that process. So I think it will really mean that, we create safe, supportive spaces, one, and two, ensure that there is space for meaning making, so that they're able to hold on to that hope also that things are going to get better. Because I think sometimes it can be very difficult for children to make sense of what's going on and to, have that long-term vision that things will get all right and things will be fine, depending on, what age group the child is in. So I think those might be key things we might need to keep in mind right now.
Samya, I think if you can take that forward and extend it also to, people who have to go back to work. Maybe people who've been working from home and now who have to go back to work. I'm sure similar issues will be coming up for them as well. So, what would messages be there?
So, the key thing is pace yourself. That's the key thing. So, if you were used to doing like an 80-hour week and you've taken a break, even if you're in good health, going back to work is going to be daunting. So take it easy. The first day back, I've always had this rule. I come back from holiday. I always keep my diary empty on the day back, because we're not, like you said, Sujata, we're not Superman or, Superwoman. That's the first thing. Acknowledge that you're not going to be able to perform to the same degree as soon as you go back. So and for the employers as well, I tell them, give people the option of graded return to work. And graded return may mean the number of hours that they spend, or the kind of task that you give. So grade it so that they have the best chance of being able to complete a task, because that's what the mind remembers. So if they make more mistakes, their anxiety levels are going to go up, and you're also going to start feeling upset as a line manager or an employer. The same thing holds for children as well. So if and I'm sure schools are thinking like this, when schools reopen, I'm hoping that the schools aren't going to start with a 5-day week, kids going to school at 8.
I'm sure they're going to do just that.
I hope they're not. I hope there are some schools listening, because it's going to be so hard for children to just be able to get up at 7 and get in the bus. They've not sat in a bus in the community for like ages now. And you have to remember, for a child, a day is very, very long. So the last few months is like a decade for them. So that's all I would say. Just face it, and I think give it the best chance of success then.
So I hope schools are listening. I hope organizations are listening. I hope teachers are listening. I hope parents are listening. Employers are listening. We need to have a whole lot of people listening to what we're saying here. Lots of important things coming up. Bhavi, last words to you.
Yeah, I think as I'm hoping too that when the schools reopen, like the person said 6 or 7 months, I don't know what that timeline looks like, but I know for sure that when the schools open, they're going to do it with the higher classes. That's obvious. And that's the age group which is going to be the tougher one to really manage, because, adolescents do not understand physical distancing. For them, everything is about backslapping, hugging. My son is 15 years of age right now, and he says, why can't we play football with physical distancing? And I say, really? How are you supposed to do that? The concept doesn't make sense to me. So that adolescent age group, I think parents are going to have to really teach them that physical distancing is something they need to follow, and that age group is going to have a tough time shifting back. And I think for the people who are going back to work, just think of it, from March. Okay, they had to suddenly acclimatize to working on screen, and then we saw so much stress in that first couple of months. And now they've gotten used to this routine, and then suddenly they jump back to working with other people with masks on their face and constantly sanitizing and watching things around them. It's not going to be easy. It's coming back to the old normal with a new normal, with all kinds of precautions in place, and having to be productive at the same time, hanging on to their jobs. It's a lot of stress for any brain to carry. So I think we need to be kind. This World Mental Health Day, supposedly the message is kindness. I hope I've got that right. Yeah, it's kindness, it's gratitude. So that's something which we need to have for everyone. Be kind to yourself when you go back. Don't expect to be the person you were in February or March. You probably walked a long journey since that time. And whoever you are dealing with as a manager or as a superior, probably the person who sits across you as your junior now is a changed individual, and so are you. So that's what I talked about right at the beginning, that we can't expect to go from an experience like this not changing at all. And I hope we're all going to be changing for the better. And we carry that back, that we carry that back wherever we go.
So, however much I'd like to continue talking and listening to you, I think we've run out of time. And that's always, the problem with clocks. Clocks continue to tick. However much, we feel that, we'd like to bring the clock to allow the clock to continue ticking so that we can continue talking. But thank you so much, Chetna, Havabi, and Soumya. I think there have been some wonderful insights. And I'd also like to thank the audience for all the great questions that you come up with. I actually had a set of questions and I didn't get through the first 4 maybe. So it's really, credit to the audience. You've been a great audience. Now over to you, Guru.
Thank you all. So I would like to put this by stating, I think awareness is the word for the day, and also from the feedback that we've received. If you see the feedback slide that stands out bold and bigger, I think that's the first step that we've taken, and we are at the end of the session, right? I feel this is the first step towards a more inclusive world, where we do not have stigma around mental health. So I think that's a very positive note for today's session and for this week. So I just came across this one person who had mentioned, I wanted to thank all of you, but I wanted to read this out for you guys. This person says, this panel is a dynamite. Really need to capture in a document and publish it. These are all things that I've been hoping they would emphasize, and it's really brilliant. So there it goes. Thank you all the panelists today for this wonderful session. I've made a couple of notes which I, as an HR, we HRs tend to forget a lot of things. But like Sujata always keeps on telling us, we HRs, I have a couple of point out. A difficult employee is often an employee in difficulty, from what Soumya said. Inclusivity mindset change will only happen when there is a firm ground in the organization for this change to happen, which we said. And what Chetna said is compassion is the key towards ourselves and towards others. So like this Mind Matter Week says, ask, listen and share in order to normalize conversations around mental health at workplace. We would like to take it forward and I would like to re-emphasize NHRDN in this regard. This is only the starting, and this will be a round-the-clock activities, and we plan to do something in line with this almost every month. That's work in progress. And thank you once again, everyone, all the audience and everybody else. Thank you. This is a wrap for the Mind Matters Week, October 5th to October 10th. Have a great weekend. I would, at the last, I would really want to thank all our partners who helped us, especially this, Sujata, Devika, the entire team, along with Fulki, our elite panelists, all the speakers, all the other agencies, Heartfulness, Mindfulness, Arogya World, who've taken considerable amount of time to put in various activities and things together. Thank you so much. And this is a wrap. Thank you all.
Thank you, Guru, but let's not do it 24/7, okay? It needs to be, we need to space that out. But I think let's get the movement started. We've got it started. We need to take it forward.
We will be mindful of
all
that.
Credit to NHRDN and HR types.
Yeah. Okay. Thank you all. Avinash, we are.
Thank you.
Thank you. Thank you. Thank you.
Bye.
Bye-bye.
Bye. Thank you.